Right. Welcome, everyone, to our final MPH virtual town hall of the academic year. Today, I am pleased to have with us three of our very own GSU SPH alumni, Brandon Talley, Gabriel Agurueta, you'll have to correct that mispronunciation, Gabriel, and then Shantae Wright. The plan for today is I'm going to ask each of our panelists to first just introduce themselves, including where what their concentration was while they were a student here and kind of what their focus is now, and what their current position is now, where they work, what they do, just briefly. And then we'll get into some facilitated kind of Q&A, and then hopefully also have some time towards the end for any of our attendees, our current MPH students, to ask some questions of all of you that I haven't posed. So why don't we start with you, Gabriel?
Hey there, and you didn't do too bad on my last name. It's Argueta, but pretty good. So hi everybody. My name is Gabriel Argueta. I graduated in 2022. So I guess towards the end of the pandemic, my concentration was epidemiology, and right now I work as a VPD surveillance epidemiologist at Georgia Department of Public Health. So that's vaccine preventable diseases, which is my area of focus now. So that involves, monitoring and response to, I guess some examples would be like whooping cough and mumps, so that's where I'm at right now. Thanks.
Great. Thank you. And Shantae.
Sure, I'm Shantae Wright. I graduated from the MPH program back in 2007, long time ago. But my concentration at that time was health promotion and behavior. And I am currently a lead evaluator or evaluation health scientist at CDC. I just got this promotion like maybe 4 weeks ago. Prior to that, I was a health scientist at CDC in the Division of STD Prevention, and I'm now in the Public Health Infrastructure Center, working on evaluating infrastructure, block grants, and also the tribal umbrella cooperative agreement.
Wonderful. Congratulations on your promotion. Brandon.
Thanks, and it's great to be here today. I am Brandon Talley. I graduated with my MPH in 2010. My concentration was health policy and management. I also just recently graduated again in December of 2023 with my PhD from the School of Public Health. I can never remember the concentration because it changed. I stayed in the program so long that like my concentration kept moving around. Anyway, I'm out. I'm done. I am the current Chief Program and Innovation Officer at the CDC Foundation. We work really closely with CDC in building public-private partnerships. So I've been here since 2007, sort of about the same time that I started my MPH program, actually. So nice to be here. Thanks.
Thanks, Brandon. Well, some really accomplished alumni. We're so proud of you guys. So, I thought we would start off with asking you to reflect on what you did, if anything, and it's okay to say, I don't really think about this then, but what were you doing when you were enrolled to prepare yourselves for entering the job market? Kind of if you're going to put on the hat of a current MPH student, what should they be doing now while they're students to improve their career and job related aspirations? You guys can just jump in as unmute as you see fit.
Okay, I can start. So something that I did, and again, mind you that I went through the master's program primarily during the pandemic, so it was a little bit hard to kind of connect the network. But something that I found to be almost pivotal and where I'm at now was reaching out to individuals in the field to try to network as best I could and kind of seek internships to gain experience, especially in some internships, perhaps unpaid, can even lead to APE sites as well. And so those connections really do help go a very long way. I actually interned with DPH during my my master's tenure, and then now I'm able to continue flowing in here and become pretty regular with all of the intricacies here. So I think that really does help, and something that I would recommend the students do is not be afraid to reach out. You know.
Yes. Shantae or Brandon?
I was waiting for Brandon. So what I did was I made sure that I worked jobs that were relevant to either health or public health, and took on projects while I was a graduate research assistant that kind of pushed me to learn or use the skills that I was learning, to make me more marketable upon graduating. Actually, Dr. Erickson was the director at the time, and he gave me a phone call and was like, Shantae, you have to graduate. You can't keep taking classes and you can't keep shadowing people, and you have to go. You have to go. But I wanted to make myself as marketable as I could. So at the time I was a pharmacy technician at the main outpatient pharmacy at Grady. So I helped them with some evaluation work there, develop standard operating procedures there, help implement change activities based on their evaluation data to try to get patients off their medicine while improving the workflow and efficiency of the pharmacy. And then when I was at CVS Pharmacy, because I was working lots of jobs, I helped with different projects that also helped improve efficiency, some of which CVS has incorporated now nationally. And then as a graduate research assistant, again, like I helped with other projects outside of my GRA. So I was always in the office during my downtime trying to figure out how I could help other people to like beef up my resume a bit. So I spent a lot of time just trying to variate things because I knew ultimately I probably wanted to work nationally or internationally. So I wanted to get as much experience as I could and a broad variety of experience. I didn't want to just be good at one thing.
Mm-hmm. Yeah. Yeah. Do you want to add anything, Brandon?
I always felt like I'd be like +1 and +2 on both what Gabriel and Shantae said. And it's funny because Dr. Erickson did the same for me, both in my master's and my PhD. I felt like I
We're
was,
glad you liked it here so much.
I got through coursework really quickly for both of them. And then it was thesis and dissertation where I just languished both of them. I would say, like, one of the things that I feel really fortunate to have been able to do was I had multiple internships, particularly in my MPH. There were a couple that I were doing sort of simultaneously, and one of them ended up being my practicum experience, which was at the foundation. And so I went from being an intern in my practicum experience to a full-time employee. And part of the way that I got there was through the GRA experience. And, it's really, and I think I feel like it's becoming increasingly difficult to connect with people and to connect with faculty in the hybrid sort of, and particularly in the pandemic and stuff, to get the networks sort of flourishing that ultimately help you get into places where you can not just maybe land a job, but also find out what you do and don't like. And I feel like I had some really amazing opportunities. And a lot of that started with engaging with faculty more, because the faculty were like, well, here, let me introduce you to, this organization that's locally. Have you thought about this organization, in ways that, you don't know what you don't know. And I think my PhD particularly taught me, like, there's a whole lot that I still don't know. And what does it mean to be like a continuous learner? And part of that is how to network really well too.
Yes.
Wanted to piggyback real quick on what Brandon was mentioning, because I also kind of found it a little bit hard to network, but one of my professors, Dr. Colin Smith, actually brought up and recommended joining APHA, GPHA, CSC, and all of these are different public health organizations that are pretty fantastic in networking, and they all have like their own social media platforms, so you're able to kind of connect and reach out to other individuals. They have mentorship programs. It's really a great way to also network, especially when you're trying to branch out and figure out what you like to do. They also have pretty good libraries.
Yes. No, I mean, there's a common theme here in all of your responses, which is really about, number one, networking and really maximizing opportunities. It sounds like for several of you, or maybe all three of you, that GRA opportunities, APE, opportunities, practicum, internships, and then really like leveraging, getting to know faculty and leveraging their networks to connect you to other organizations, other potential collaborators. And I know for many of us, myself included, that sometimes it's so much easier to not do those things, right? Like you have to really be proactive. And for folks that maybe aren't as outgoing or extroverted, that is a particularly hard thing to do. But I think what all three of you really highlighted is just how important that really is for getting the job. Yeah. So I know you may not be able to speak to what your specific current employers are looking for in employees, but can you share with our current MPH students kind of what kinds of qualifications do you think employers in the field are looking for in a recent MPH graduate? I'll start maybe Brandon with you. I'll go in reverse order.
I think it depends on the role. Certainly there's more specialized roles. I feel like even in my dissertation, my role was a little bit more on the generalist side, both with my MPH and my PhD. So I think part of it is also sorting out, do you want to be more of a specialist or more of a generalist in terms of your public health practice? Because that can guide things. But if we're getting on the balcony and thinking about general skills, public health is facing, and I'm speaking like personally, not on behalf of my organization on this. I feel like public health is at a major crossroads in terms of what does the future look like for funding? What does the future look like for what types of programs we can and cannot do? And fundamental to that is being able to be adaptive and find ways to navigate the really complex space that public health is in. Really a lot of this was lingering long before the pandemic, but the pandemic really opened up trust issues with institutions, whether it's government or universities or a variety of other things. It opened up a lot of inequities in what's happening in terms of how we apply and practice public health. Things that have been there for a long time, but really came to the foreground. And I think being able to navigate that uncertainty is something that is really, really valuable. And it's hard to teach. Like it's not something you get in your regular curriculum day to day for the most part. I mean, but I think it's finding ways to learn from others that have been able to embrace change management and trust building is going to be really a critical skill going into the next 5-10 years of public health as a field.
Thank you. Yeah, Shantae, thoughts to add?
Yeah, and this again is just like Brandon, generally speaking, as a civilian, I'm not speaking on behalf of my organization, but I think that employers, trying to keep my job here, the employers are looking for recent MPH graduates just to have knowledge that can be applied to a variety of projects. I think a lot of times we graduate, we're stressed out about, do I have this skill, that skill? I'm going to tell you, like, I think being intuitive, being proactive, being resourceful, being inquisitive, being positive, and demonstrating that during your interviews will take you a long way, because a lot of people graduate with skills. We all take the same classes. So you really want to be able to set yourself apart. And then for me, I want to talk a little bit on the other side about what employers are not looking for is an inflated resume. You don't have to be the expert on everything. I've seen a lot of this lately, and so I just want to speak to it because I just got on to one of my fellows about this. But you don't have to inflate anything. You don't have to overstate anything. Just be confident about who you are and your ability to be resourceful. I think that's going to take you pretty far.
Yeah, thank you, Shantae. Gabriel?
Yeah, those are excellent responses. It took a lot of the items that I was going to say. Again, speaking from my own experiences and background, and also trying to keep my job, I think to follow up on what Shantae was mentioning, I think something that employers are looking for, again, not so much the inflated resume, but also the willingness to learn and adapt in these new scenarios. I think most employers have an idea that you might not be fully, I don't know, having all the experience and all of the accolades that they might have expectations for, but I think being open and willing to learn and to provide that, I guess, additional level of, I don't know how to word this correctly, but just the want to actually expose yourself to different areas and not being too hard-headed in the one specific thing that you do know how to do. I think public health is one of the most interdisciplinary studies. You don't have to have a specific background. Everything will mesh into itself, but being open to new experiences and learning and trainings, etc., will take you a long way.
It's interesting because all three of you really were speaking more to less about kind of the hard skills that you would put on a resume and more about kind of interpersonal skills and more about kind of qualities of someone going onto the job market, like taking initiative, inquisitiveness, resourcefulness. So that was really helpful to think about it in that way. So I think that's also hopefully going to be helpful to our current students when they're thinking about how to present themselves in a job interview, the kinds of qualities that they may want to highlight. That was really helpful feedback, I think. So talk to us a little bit for all three of you, how you started your job search. Were you already kind of looking while you were an active MPH student? How did that job search kind of unfold? And what recommendations would you have for our current MPH students, particularly kind of like the second years? Where should they begin? Shantae, why don't we start with you this time?
Sure. So I started my job search using Indeed, and then also by telling everyone in all my classes what my career intentions were. Because at the time, Georgia State had just started their MPH program. Dr. Erickson had given me my notice that I had to leave. And so I was like, look, guys, I got to get out of here. Dr. E said I got to go. So does anybody have any, like, literally, I did that in every class because I knew there were so many different people in there working different places. And so it just so happened that one of the young ladies in the room was interning for the Georgia Cancer Coalition. And they had a spinoff organization, the Georgia Center for Oncology Research and Education, that needed an intern. So she was like, oh, if you send me your resume, I was like, I have a resume right here. I handed her my resume and I emailed her my resume. And she gave it to them. And within like a week, I had gotten an interview and I started interning there. So I had 3 jobs at the time. I was interning at Georgia, at the Georgia Core. And then I was working at Grady, still at the pharmacy because I needed to pay bills and all the things. And then I also worked as a GRA. So I was trying to set myself up before I graduated because I knew that even though that was an internship, it could turn into a permanent position. And it did. As soon as I graduated, they promoted me. And then I stayed there for 4 years before I came to CDC. And when I did the job search for CDC, of course, I used usajobs.gov, but I leveraged my network as well. So I used people who had already graduated from Georgia State and were at CDC. I used them to help me navigate that process because it was just different than anything I had ever experienced as far as trying to get through that system. But that's what I did.
And so Shantae, just quick follow-up, when you were leveraging your networks to help you with the CDC job application process, how were you connected with those GSU alumni who are now at CDC? Was that through faculty or through our alumni group here?
Neither one. So we were all GRAs together. We wrote our master thesis together. We would go to the coffee shop 3 times a week and work on our master's thesis. And then she also connected me with other folks at Georgia State who I hadn't met. So I used our student network to navigate.
Okay. Wonderful. Well,
I
you
was a
were-
little shy then. I was a little shy about going to the professors. I had already asked them for so much, and they were trying to get me graduated.
You
So
definitely don't come across as that. None of those things you described were things done by a shy person. I mean, you were definitely like working the students network, which, you know, is a wonderful thing to do, especially at a place like GSU, where so many of our MPH students are, you know, do have well-established career networks, professional networks. Gabriel, how about you?
Yeah, so I definitely used, I want to say I used LinkedIn pretty hard in the beginning part of those stages of me looking for a position, just because I was looking for other individuals from Georgia State that also were in some of the roles that I was interested in. Outside of that, you know, the general ZipRecruiter, Indeed. But I also used the job boards that were associated with the public health organizations that I was looking at. So for me, I had interned with a couple of different surveillance programs, even interned with CDC in my undergrad and during my MPH program. So I was able to kind of network and meet some other individuals that way to begin with. But I guess when it comes to the actual application process, you know, I felt like I had a pretty good resume, but I would not apply to some positions because I felt like perhaps they would not be interested, and I realized that that was silly. And so my one recommendation is to not think that you're not able to apply to some of these positions just based off of that. I think you know you should know, I guess, or I guess you should be able to apply to as many positions as you like to, depending on your ability to. And I think the more the merrier. I applied to so many different positions and eventually actually got out of my own comfort area. Something that I was very interested in initially was chronic health. And now I'm in infectious disease. So it's just, you know, really depending on what you're interested in. I took surveillance into a whole different area. Each single topic can be an entire different subgroup as well. So just really applying to as many different positions is what what worked for me at least.
Yeah, no, I think that makes perfect sense. Yeah. And then Brandon, how about you?
I feel like I took sort of a hybrid approach between what Shantae and Gabriel took, because I was switching careers. I'd been in the private sector for a decade-ish when I started my MPH, and I felt like I was behind. Like I hadn't been focused in healthcare. I hadn't been focused in public health, and I was a little bit worried might be too strong of a word. I don't really worry very much, but like, how do I catch up? And part of my strategy for that was to build really close relationships with faculty and lean into the networks of people who I trusted and that trusted me to work with them as a GRA, or as, you know, the variety of things that I did. And that really helped me be a bit more targeted in my approach, is how I sort of did it. But I feel the network was really, really key. I mean, I think we keep hearing this over and over again. It's like you've really got to engage with the network in order to really be able to get things moving, I think.
Yeah, I think so too. I'll just kind of insert a couple of the questions that are being asked as you guys talk, instead of waiting to the end. The first question is kind of reflecting a little bit about the, you know, applied practice experience, other internships. You know, again, for you all, kind of speaking for yourselves, just kind of as a civilian, not as a spokesperson for your organization, but kind of what's your hunch about, you know, to what extent does it matter to employers more broadly about whether these experiences have been done in person versus virtually? Any initial reactions to that?
I have some mildly strong reactions to that one, so I'll jump in.
Yeah, go for it.
I think it depends. If it's a role that is highly technical and doesn't require a lot of regular engagement with team members or the public or the field, I think it's fine. Like, the virtual environment tends to work really well for that. There's also a lot of work that's super relational in terms of, like, I started my public health career in global health, which was, I think is sort of a rarity because I had zero global health experience. And it's like, it feels like there's this, you want to work in global health, but nobody wants you to work in global health unless you have global health experience. So it's like this vicious cycle if you can't get the experience to do the thing you want to do. And I was really fortunate in my practicum was global health, and I had amazing mentors, really incredible mentors, both at CDC and at the foundation. And we did a lot of work with WHO and in-country work with WHO, and the relationships, like the in-person time, mattered so much to building trust and being able to get work done. And I think I think the world has become more open to that in general. And also having in-person time and being able to work really closely side by side with someone is an opportunity to gain trust and learn so much more quickly about how to interact. It also is like you move up in terms, like, career wise from a like management standpoint, how to be a good coach and how to be a good mentor and how to be a good leader. Dr. Mason, who is on my who is a brilliant like teacher and talks about statistics as being craft knowledge. Like it's something you have to work at constantly. And I feel like relationships are the same way. It's like you don't sit down and read a book and like, okay, this is how this relationship is going to work. It's like, oh, well, that minister of health is very different from that minister of health or that state health officer or that, and it's how do you navigate that complexity? It's very much a learn by doing and learn by seeing model. At least it has been for me. And, I'm one person's experience, but that's sort of my lens on it.
Yeah. No, I think that's a great point. So it really does depend on the nature of the work that you're doing and the nature of the career domain that you're pursuing, right? As to the appropriateness of virtual versus in-person experience. Yeah.
Yeah, I agree. I think also it's a matter of the transferable skills that you can receive from the applied practicum. So I did mine, I guess, in the midst of the pandemic. So I was somewhat hybrid, and I did mine with CDC's Cannabis Strategy Unit. So in that role, I was handling a bunch of large data sets, using different analysis tools, just kind of getting a good idea of what the whole entire process was. And some of this was in person, some of this was, online. So I think the big thing was for me with that role was just being able to take that experience and apply it to what I'm doing right now. And then also, I think Shantae mentioned this previously, but when you're in your actual interview process and you have this specific piece of information on your resume, it's really how you express that. So if you're saying you do A, B, and C, it's great that you have it already spelled out, but like, what was the actual like personable experience and how is that helping you out right now? So rather than just say, oh, I did this here, you could be like, well, this is what I did then, but this is what I could do now with that,
Yeah, so let's talk a little bit more now just to dovetail on that, because there are two questions in the Q&A that are related to resumes. And I know, like Shantae, you mentioned like, don't overdo, you don't need it to be the expert of all things. And, Gabriel, you talked a little bit about resumes. So, kind of first of all, one person, commented that it does seem that in some job portals, career portals, that oftentimes just getting your resume in front of someone, just getting it seen can be so hard. And that in some cases, maybe there's AI involved, there's a system that's looking for certain keywords in a resume. So how would you all recommend to MPH students now? What are some of the tips other than Shantae not kind of overdoing? What are some of the tips around just getting your resume seen by the potential employer and kind of follow up? To what extent is kind of personal branding need to be involved with that. So should you have a personal website where you're putting some of your products that you can link potential employers to? So help the MPH students think about how to prep their resume to be noticed. Shantae, do you want to start?
Yep, I was just making a note that I wanted to mention at the end of what I'm going to say. So generally speaking, the evaluator in me wants to tell you to do a crosswalk between what they're asking for in your job description and what your skills are. So if you do that for each situation that you're applying for, then you'll be able to highlight the relevant skills that they're looking for, because a lot of places are going to do like a paper review. They're going to do like, they get a lot of resumes. They have some sort of scoring system, and they're just going through and check just to see if you even meet the minimum qualifications. So you yourself should do a crosswalk and put yourself kind of in their shoes and do that. So that's my first tip. And just to make sure you have the relevant skills. And I would include any paid positions, any internships, any volunteer positions. Don't sell yourself short. We've had a lot of folks get to interviews and then they start telling us about all the stuff that we didn't see on their resume. And I'm like, wait, you volunteered for this organization? Like, you should have put that on there. So you don't want to inflate, but you also don't want to sell yourself short. As far as a website, I don't know if anyone's going to do the extra work and go to a website, especially in my realm, but I will say that people do use Google, and ResearchGate is an excellent place to put your deliverables, your collaterals, anything you're developing, reports, things like that, and it will get read internationally. And sometimes people will reach out to you and ask you to expound more and to let you know they have this different position available. I've had that happen to me. And so I would definitely put your things up on ResearchGate, because it's a lot harder for folks. The internet is huge, and it's a lot harder for folks to navigate and get to a website that you created versus ResearchGate. A lot of us are already on there and we're looking for information all the time. I'll stop there.
Those are great tips. Brandon, do you want to add? And then, or Gabriel, you want to add? Go ahead, Gabriel. So you unmuted.
Sorry. Yeah, no, to add on to that, I think something that really helped me out with my resume was, I think I had one basic resume that I was sending out to a lot of the areas, and when that really wasn't working too well, I started shifting and trying to make my resume a little bit more personable to what I was applying for. So on the same lines of what Shantae was saying about not overfilling your resume, I think you can also take out things that aren't really going to help, but in some cases it might help. So let's say you're looking for a role in public health that's going to be face fronting with the public. You might want to include something that's more customer service or something like that base, so that you can, relate that skill to it. So in some cases, I think it's helpful to at least shift your resume to some extent, just to highlight some of the other areas that you're working on. And that can give you a potential leg up. And that's really the only tip I have regarding that.
Yeah. Okay, that's helpful. Brandon, how about you?
Proofread, because once it gets out of that, like that swirl and shuffle of getting through the, all the reviews that happened before, like I literally, when you're like looking at resumes or CVs, it's like you can look at a resume in less than a minute, or a CV in less than a minute. It's like you read through them really quickly, and it's, things that don't add up, or Shantae, to your point, things that look overstated, or, it needs to tell a complete story in a very concise and clear way about who you are as a person and the work that you've done. And thinking about it like that as a story about yourself is, that really shines through. There was one person who his resume was really great, and he did for the sake of like protecting privacy, I won't say what it was, but he had this very interesting hobby, and it was the very last thing that he put in like other things that he had done. And I was like, that's really funny. I just want to like talk to him, because I want to understand more about like what did you do? And his CV was compelling anyway, and then it had this like little ding, that just like gave it a little like pizzazz. the other thing too is, and I'm horrible about this. So like the LinkedIn presence, I don't necessarily think a website is particularly helpful. It could work against you. Like you've got to manage your brand and like the content and all of those things. So it's like, if you're going to do that, do it well. But a recruiter is not going to be looking, recruiters are going to be looking through LinkedIn and other things like that. So having your presence on those types of things be really like clean and crisp and compelling, because organizations use it all the time for recruiting, even in public health. And so that's at varying different levels, and particularly in like specialized roles that are really hard to recruit or like find talent for. Recruiters are often, they have completely different levels of access to LinkedIn than we do, like a typical like user does, and
Right.
how they can come through and mine data in it. And so that's an area that would be worth, spending time, perhaps, rather than sort of your own developed sort of website or something like that. If you had to choose, like,
Yeah.
time's precious if you had to choose between them.
Yeah. Yeah, no, I think that's helpful. So let me just look. I think, Gabriel, there's a question in the Q&A that's kind of specific to you. So I'll let you look at that one. So a question, and this kind of relates a little bit to what we were talking about kind of at the top of the hour. How do we navigate jobs that require experience in a specific sector, tobacco cessation, mental health, when most of our experiences are maybe in something different? And I think, Shante, I think it was you who noted, that perhaps more importantly are the skills that kind of cut across specific health content areas. Is there anything else you would like to say to follow up on that particular question other than what I just kind of restated, or would you say more?
Yeah, I mean, I think to speak specifically to this, think about your volunteer experiences. So when they require experience in a specific sector, they don't mean job experience necessarily. So if you are interested in tobacco cessation and you've participated in some other activities, like put that on there. Also take the opportunity to describe what your public health interests are as a recent public health graduate, because sometimes if they require you to have experience in that sector, but they see that you have skills that can be applied, they may overlook the fact that you don't have that specific sector experience, but you're interested in it and you're showing interest through the different things that you've participated in. So you have volunteer experience, you have internship experience, things like that in there. So don't discount those things just because they ask for you to have specific sector experience. I would still apply and zhuzh it up a little bit.
Mm-hmm. Yeah, and just think creatively, right? About, what maybe you don't have a lot of deep content knowledge in tobacco cessation, but you have some exposure to some skills that may be relevant there, and kind of emphasizing that. That makes sense. Gabriel or Brandon, anything to add to that? Okay. And actually, Shante, this is kind of following up on something you said about highlighting volunteer experience as well. Should that experience be geared towards public health specifically, or that's one of the questions? Is it okay to include non-public health volunteers?
I think it is okay to include non-public health volunteer experience. And I'll tell you why, because people are multifaceted. And as we look at different things like social determinants, systems thinking, different approaches that folks are using to address all the different disparities that we're seeing right now, I think you would be remiss if you didn't include non-public health things. So I think you should include those things because all the different systems work together. So definitely don't not include it. I would include it.
Yeah. Yeah. And I guess I was also thinking about, just social determinants of health and how public health, as we like to say it, GSU, SPH, like health in all policies, and how health really cuts across virtually I'm biased, but virtually every activity, right? And so I would be willing to bet that most volunteer experiences you could probably link in some way, shape, or form to something health related too. So it's also kind of thinking more holistically about what we mean when we talk about public health. Let's transition a little bit to job interviews. So what did you all do, if anything, to prepare for job interviews? Do you have any tips for going into a job interview that you want to share? Brandon, why don't we start with you?
I mean, be prepared, which seems like such an obvious answer. Like, read the job description, know it well, know about the organization, you know, as much as you can. And I would say possibly like go beyond their website if they have, you know, partnerships they work in, you know, those types of things. So, you know, CDC, for example, is huge. So it's, you know, also tailoring, you know, depending on what, if it's a really big organization, sort of tailoring that to understand more deeply the content area that you're applying for is really, really super valuable, and it shows. I feel like being prepared to say I don't know, and not be afraid to say I don't know, and to give yourself a moment to reflect during an interview is really important. I don't know, I feel like if you're going through a good interview, you're going to get questions that you're not going to have the answers to, and part of that's a test to see, like, how do you respond to uncomfortable situations. And because sometimes the hardest thing to do is nothing. Like when you're in like a work environment, you know, a lot of us are like, I got to get it done. I got to figure it out how. I need to do it independently. I need to and we don't take a beat to reflect, like, wait a second, let me just give it 24 hours and see what evolves. And you know, that's one of the soft skills that, like, we've been talking about, that it's hard to teach, but employers want to like figure out if you have the ability to do some of those softer skills, and being able to say, you know, I don't know, or reflect even during a time of like pressure and stress. I mean, interviews are stressful. Also, interviewers are very different. Some are very like, you know, they're gonna look at your resume like this because they're trying to distract. They're not gonna look you in the eye. They're gonna try to distract you. I mean, some are going to be very stern. Some are going to be super friendly. It's being prepared for like the range of different personalities that you're going to face in an interview, and knowing that every single one is going to be different. And it may be different as you go through like a series of interviews within an organization too. Yeah.
Yeah, I think those are great tips. And I think as a teacher, we also often struggle with like the silences, that like there's a discomfort that comes with silence when you ask students a question and then there's just silence, and we just are often wanting to fill the silence. And there's nothing wrong with giving the time and the space to think, to take that pause. And I think as an interviewee, you're right that you can say, you know, I haven't really thought about that, and I'd like to give that some more thought, and would love to follow up more with you about that. Or even if it's just a few moments to get your thoughts together before you respond. I think sometimes, yeah, we're so nervous that we're motivated to respond immediately. And I agree. I think it's important to remember that you can take a moment, and you can say, and probably is better to say, I don't know, instead of make something up.
Yeah, it's way better than overselling yourself, because even if you land the job and you have oversold yourself in the interview, it's gonna come into the light eventually. And it will have been a major trust burner if, I'm just making this up because this hasn't happened, but like, oh yeah, I'm like M+. I know how to use M+. Would I consider myself an expert user of M+? Definitely not. And if I was like in a pressure situation, it's like, oh yeah, I'm an expert at that. And then they're like, well, but you can't do so and so and such, like 3 months later, what, you called yourself an expert? Like,
Right, good point. Yeah, Gabriel, how about you?
Yeah, to piggyback on what Brandon was saying in terms of, you know, interviews being intimidating to some extent and taking some time to reflect. I think that it's really important to breathe in between some of these interview questions and to try to like get your center focused there. You know, some of the questions you may not have the best answer to, some of the areas you might not have the most experience in, but I think, you know, speaking openly, some of these positions, they're also looking to fill the role just as much as you're looking for a position. So it's not also just as like what they're wanting and to adhere only to them. You know, you're also in this equation as well. So it's important to take into consideration how you're feeling about the position. Is it really something you want to do? You're allowed to ask questions. You're allowed to follow back. You know, again, obviously some level of professionalism, but still, you know, it's just you're in the same position as they are in terms of being in the interview process. It's not just one individual doing one thing. So it's important to ask questions and do follow up. And then over half the time, they're never, um, I think they prefer you ask questions rather than you sit there quietly and then ask later on or feel like, you know, you might not fit for the role, but then you find out way later after asking a question that you actually do. You know, so it's just really important to get as much information as possible just so you understand what you're looking to do and where you're trying to go with the position.
Yeah, that's a great point, Gabriel. Because even in an academic setting, when I've done interviews for research coordinator positions and other kinds of academic jobs, you know, interviewing someone where it's completely one directional and the interviewee is like only responding to my questions and when you say, well, did you have any questions for us? And it's like, no, you know, that doesn't show me that that's a strong applicant, frankly,
Exactly.
because they don't seem very plugged in or engaged or excited if they're not asking me questions too, or it doesn't seem like they're very inquisitive, right, about the organization, the work, and so forth. So I think
There's also a level of interpersonality between the interview and the interviewee. So, you know, I think it's important to also kind of showcase that, not just specifically your experiences and your abilities. You know, how do you talk? Are you eloquent with your speech? Are you friendly? Are you, you know, following up? Are you asking questions? There's a lot of different aspects to the interview outside of just the piece of paper and the resume. You know?
Yeah, Shantae, did you want to add?
Yeah, like those are all amazing responses and tips. I was going to say, in addition to being prepared and doing your research, try to find early on in the interview a way to connect that is memorable and meaningful. Because what it does is it kind of, like Brandon said, like sometimes you have that person that just has the paper in the hand and they're just ready to get the interview done because they have 10 of them to do. But if you find a way to connect with them, then it imprints in their brain like, oh, well, maybe this is someone that I really should listen to. I know I'm here to listen to the interviewee, but I should really pay attention to what they're saying. The other thing I wanted to mention is that you've gotten to the interview point. So clearly they like something about you. So definitely try to relax into the interview. People hire people, not words. So make sure that you're personable, that you're making eye contact, even if it's if you're doing an interview through the computer, practice looking at your camera because if your eyes are wandering, that's really distracting for folks. Make sure that you're smiling, that you're leaning in, that you're also using the appropriate intonation. So when you're speaking, you're raising and lowering your voice so that you sound interesting. I've been on an interview with someone who was just completely flat affect and I almost fell asleep. It was the worst. I was like, oh my goodness. Like it was an amazing candidate, but he was just so flat. I said, I cannot listen to him one more minute. And then also stick to the question. So if they're asking you a long question, and we do this a lot, but if they're asking you a long question, don't be afraid to write parts of the question down, like key points of the question, and repeat those parts back to them to make sure that you're catching everything. And then on your little piece of paper, like check it off as you're addressing each component of the question. Because sometimes people ask multi-part questions to see if you pay attention to detail. That's the one thing that they're looking for in their question. They don't care how you respond to it. They don't care if you have experience with it. They're just trying to see if you can answer each part of it. So don't be long-winded, be succinct and thorough, and then always ask a meaningful question at the end. Some people actually score that in the interview. And so if you don't ask a question, it looks like you're not as interested in the position and you might receive a lower score.
Shante, is there a question that you would kind of think about as being a meaningful question at the end that you've heard from others or that you posed yourself when interviewing?
I did. I'm going to tell you. So when I was interviewing for this position, I think I interviewed around the week of Valentine's Day. And one thing that I kept doing during the interview is, so when I get this position, so one thing I know that you're looking for me when I get this position, I just kept responding like that. I'm just using a little psychology, but one thing I did ask at the end was, what does success look like for me in this position in the first 6 months? So what would make you say, man, I'm so glad we hired Shante. What do I need to do in the first 6 months to make you feel that way? And they just kind of look back like, okay. And then they start firing off all these things. And what I did, I wrote down all those things. And on my first day, I reminded them what they told me and asked them if there was anything else they wanted to add. And so I think that's a way to keep yourself memorable and set yourself apart. And it connects you to what they're saying. It puts yourself in the position, you're looking for success. What does that look like in the first 3 months, 6 months, whatever time frame you want to pick? But it lets them know that you're interested and that you see yourself in the position, and hopefully they do as well.
Yeah, those are great tips. Yeah, Brandon, you look like you're about to say something.
Shante, Gabriel, like, it's awesome to like be in the room with you. I felt like I'm like learning and learning and learning. It reminded me, we had an interview for a senior executive here, and I was on the interview panel, and she was brilliant with the types of, exactly, Shante, the types of things that you're saying, because I left the interview not only like knowing about her background and her narrative and her story, but I learned a lot from her about like philosophy as a leader and philosophy as and I took meaning away. Not just, it just wasn't an interview. I took meaning away that actually enriched how I think about my own work from the interview and it was powerful. Like I still remember exactly the couple of things that she said that I was like, yeah, totally. And I was like, I can't. And it was at the time that it was pandemic related, and I was working from home, and my husband came in, and he went right at the end, and I didn't have headphones on, which because he came home earlier than I was expected from work, and the interview finished. He was like, "She's really great. I really like her." And she's really great, and she's awesome.
Yeah, I mean, I think you both were making some good points about, how do you make sure that you are memorable to an employer, especially if they're doing a lot of interviews, they kind of blur together. How do you make yourself stand out? I think you both gave really good examples of that. And Gabriel, you highlighted, some ways to make yourself stand out as well. So we're about 5-6 minutes to the end. Attendees, if there are any other questions that you have, feel free to add them to the Q&A while you think of any, if there are. If the three of you could reflect on, if you could go back and do and be an MPH student, go back in time, and you could do something different with respect to preparing yourself for the job market, doing something differently with resumes, interviews, whatever, different kind of coursework. If you could do anything differently, would you? And if so, what would that be? Gabriel?
Yeah, I guess, I think for me specifically, there was a lot of things that were limited being, kind of hybrid, mostly online. But I definitely wish I would have taken more opportunities and experiences at GSU through their, through the School of Public Health's different activities that are going on, or webinars, panels, etc., just to get a better understanding of what's going on, what's out there. I did do a pretty good job, I think, in terms of networking, but I just really wish I did a little bit more, and I wasn't so I wasn't really afraid to reach out to different individuals in different fields, but I didn't do it as often or as much as I should. Now that I'm kind of in the field, I'm realizing that, everybody's always willing to network and talk. So if you have a question for somebody that's in the field doing something you want to do, shoot an email, try to link in, do something at the very least rather than not, because that way, if you're not gonna get an answer, at least you're making the option to do so in the beginning. But, yeah.
How about you, Shante?
For me, one of the things I would have done different was work on my quantitative analysis skills. I love qualitative research and really strong in it. It comes naturally to me. And I was traumatized after doing SAS in my statistics class. And I aced the class, but SAS was my nemesis. So I wish that I took advantage of more opportunities and pushed through and not let that shake me. And just try to find opportunities to practice machine learning as it relates to public health. I think there's a lot that's getting ready to come with that, especially with the AI the push that we are moving towards. So that's what I would go back and do different, because that's what I'm looking for right now as I build my team. So I'm going to be looking for things like that that I see is a real gap in my area. So that's what I would go back and do different.
Okay, it's helpful. How about for you, Brandon?
Be less afraid. I mean, I'm not a particularly like anxious or like worrisome person, but I feel like my PhD cohort particularly was filled with a lot of great colleagues that a lot of them are from CDC, and I had considerable more like public health experience than I did. And I remember sitting in, quantitative methods classes and stuff and being like, what am I doing here? Like, it was a little bit of the imposter syndrome kind of thing where, like, we had a really good cohort of people that would like do homework together and, do those types of things together. And, I would sometimes get different answers than they would. I'm like, surely their answers are right and mine's wrong because they have way more experience than I do. And oftentimes it was like that was not the case. It was because I had to go more slowly through some of the things. I tended to be like double check and triple check because I was always a little uncertain. And I think embracing that like fear and uncertainty a little bit would have helped me accelerate some of the learning in areas that I would have wanted to push more on. And not being so like, I can't do it. I'm not an expert in it. I think would have helped. I think I probably would have I tended to follow the lead. Like my friends took these classes, so I'm taking these classes too. So I'm not all by myself because I think I would have branched out a little bit more and had slightly different experiences, which would have been great.
Yeah, that's great advice. Well, we are at the top of the hour. That went by so quickly. I feel like I learned also from the three of you. So hopefully the attendees got a lot out of it. I'm sure they did. And we will post the recording for those students who are not able to join today. I think the three of you really provided a lot of helpful guidance and feedback, tips for our current MPH students. And I got a couple of requests for your email addresses. So I requested folks to email me and then I can connect people to you with your permission. So I'll follow up with the three of you later. But just want to thank the three of you so much. We're so proud that you are GSU SPH alumni. And so you do us proud as a school, and congratulations on all of your work out in the field. And we just appreciate your time so much today. Thank you. Bye-bye, everyone.
Thank you. It was a pleasure.
Thank you so
Bye,
much.
everyone.
Wonderful. Have a good one.
Bye,
Take care, y'all. Bye-bye.